Have you ever heard a person say, "I have TMJ"? Perhaps you've said it yourself or heard a doctor say it. Let me set the record straight. TMJ stands for temporomandibular joint. Everyone has two TMJs. They are the jaw joints on either side of our face. TMJ is a body part. It is not a diagnosis. I'm Dr. Vita, and diagnosing and treating patients who suffer from TMJ problems, headaches, neck pain, and facial pain is what I do.
Do you suffer with jaw pain or clicking, facial pain, neck or shoulder pain, or headaches? If you have these symptoms, you may have a TMJ problem. The very first step is to find the cause of the problem. Let me give you an example. Suppose you have a toothache. The pain you have is a symptom of the problem with your tooth. You certainly wouldn't choose to simply take a pain reliever and think that because the pain goes away or gets less, that the problem with the tooth is fixed. The same applies to your TMJs. If you have pain or other symptoms, it means there is a cause that needs to be identified. You need to have an accurate and appropriate diagnosis of the problem. Only then, correct treatment can be suggested, which will effectively fix your problem and therefore relieve your symptom. You may be wondering, how does Dr. Vita determine a patient's accurate diagnosis? Dr. Vita begins with a review of your complaints and history and does an exam. Many times, this is not enough to make the most appropriate diagnosis, and it is necessary to see a picture of what's going on. Let's go back to your toothache. If you go to the dentist and he or she looks in your mouth and says, "Yes, I can see a big cavity in that tooth," he or she would not start treating that tooth unless they took an X-ray to confirm and give a more detailed picture of what cannot be seen from the outside. In the same way, Dr. Vita may recommend that an MRI of the TMJs may be taken so that he can properly and accurately diagnose your TMJ problem. After this important step, treatment options can be understood, suggested, and discussed. You can learn so much more by visiting drlewisvita.com and clicking on the TMJ links on the homepage. Then contact us for an appointment and begin to understand your problem, get correct treatment, and get better.